The steps in any rescue are known as the 4 A's. Awareness, recognising an emergency and accepting responsibility. Assessment, making informed judgments and developing a plan. Action, performing a safe and effective rescue. Aftercare, providing care until professional medical help arrives. In any aquatic emergency situation, self-preservation is a key factor in attempting a rescue.
Non-swimmer. A non-swimmer may use desperate grabbing and climbing arm and leg action. They will be vertical in the water and will not necessarily be facing the shore. Their only concern is their next breath. They seldom wave or call for help and may not respond to instructions. Generally, they will cease to panic when their face is clear of the water. Quickly attempting a rescue is important as a non-swimmer may soon become an unconscious person. Weak swimmer. A weak swimmer could be using legs and arms for support. Their head may submerge from time to time. Their body position is at an angle to the surface facing the shoreline. They may act on clear instructions and may be able to float on their backs and kick.
Injured person. An injured person may be in an awkward position in the water. This is caused by grasping the injured limb or area. The injury may or may not affect their ability to stay afloat. Look for expressions of pain. Their response to instruction may be poor due to the injury. The rescuer should note the area of the injury and avoid aggravating it. Unconscious person. An unconscious person will be completely limp in the water and will not be able to cooperate. They may be found at any point between the bottom and the surface, as buoyancy may vary. Immediate contact and support is required, and if no signs of life are present, resuscitation is a priority.
Talk rescue. The first method of rescue used should be your voice. Many weak and injured swimmers can be encouraged to return to safety.
I can't run this water. You can do it. Too far. You can do it. Keep on kicking and paddling your hair. You can make it. Too far. You can make it. Try kicking in. Come on. Come on. Stop.
Reach rescue. A reach rescue is a quick, effective and safe form of rescue.
Help me, help. Help me, I can't swim. Help me. Try reaching the stick.
Remember to get down low and keep the rescue aid above the surface of the water. The rescue will be more effective if you place the aid across the shoulder. Pull in slowly, giving encouragement and instruction.
Throw rescue. Throwing a rope or a buoyant aid to a weak or injured swimmer is an excellent form of rescue. Calm the person and inform them of what you are doing.
I'm going to throw this rope back to you. I want you to grab it and I'll pull you in.
Coil the rope evenly into one hand. Try to avoid moving this hand and allow the coils to lie on the ground to avoid tangling. Continue to give encouragement.
Calm down, don't worry.
Place your front foot on the end of the rope. Split the rope, leaving one strand between each hand. Throw the rope leading slightly with one hand. Aim for a point beyond the person in difficulty and try to throw the rope over their shoulder. Pull in gently, hand over hand, giving encouragement and clear instructions.
Wade rescue. A wade rescue can be used when the depth, current and temperature of the water permit a safe entry and attempts to reach or throw have been unsuccessful.
Help!
Locate a suitable reaching or throwing rescue aid.
Please help me. I can't swim.
While slowly wading in, calm the person and provide encouragement.
Calm down. I'm going to pass down.
When the rescuer is close enough to the person, reach out with the aid. Pull the person to safety and assist them out of the water. Assisted walkout exit. An assisted walkout is used when the casualty is exhausted and requires assistance. Slide your head under the person's armpit. Hold the wrist of the person's arm which is around your neck and put one arm around the person's waist. Walk beside the person providing support.
Row rescue. Using watercraft can be an effective and safe technique of rescue. The rescuer remains clear of the water and can quickly reach the person in difficulty. Provide encouragement and secure the person quickly and safely.
Grab onto the back of the boat and I'll tow you in.
This form of rescue should only be undertaken by those experienced and licensed to use the particular watercraft available.
Approach, defensive position, and reverse. To start any swimming rescue, the rescuer must use an appropriate entry for the environment. Approach whilst observing the person in difficulty. Maintain a safe distance and move into a defensive position with one knee bent and the other straight. The defensive position protects you from being grasped. In every rescue, your own safety is of most importance. Always adopt a defensive position. If attacked, kick vigorously and sweep with both arms to move backwards and to safety.
Accompanied rescue. If the person in difficulty is some distance from safety, you should first attempt an accompanied rescue. Enter the water using an appropriate method for the environment. Take a buoyant aid, such as a PFD, kickboard, or esky lid, and swim out to them. Adopt a defensive position and keep the aid between you and the person in difficulty at all times. It is important in any rescue that you give clear instructions.
Yeah, now kick in, kick in.
Once supported, swim in front of them, keeping a safe distance whilst observing their progress. Encourage them to kick back to a point of safety.
Non-contact tow. If you must perform a swimming rescue and there are no buoyant aids for use in an accompanied tow, your next choice should be a non-contact tow. Using either a rigid or non-rigid aid, swim out to the person in difficulty, giving encouragement. Adopt a defensive position and offer them the aid, in this case a shirt. Give clear instructions and if possible get them to lie on their back. If they are cooperative, always get them to kick. When towing, keep directly in front of them, not out to one side, as this is most efficient.
Contact tow. Only as a last resort or when rescuing unconscious people should you perform a contact tow. If you suspect that they are unconscious, enter quickly as speed is important. Still adopt a defensive position and check to see if unconscious. Gently roll the casualty over. There are many different contact tows, all of which abide by the key principles found in the Swimming and Life Saving Manual. Some of these are to allow for freedom of rescuer's swimming movements, to give the rescuer control of the movements of the person being towed, to keep the person's mouth above water at all times, to try to keep as horizontal as possible, to give control of an unconscious person's head. If the person being rescued is conscious, you should use a contact tow, such as the wrist tow. Remember to grab hold of the back of the wrist in case they struggle.
Team search pattern. The basis of any search pattern is knowing that every area has been searched. To achieve this, you must first face the bank, perform a feet first dive, and check the bottom about 1 metre from the edge, and then surface. Having surfaced, turn and perform a head first dive and check the bottom for about 2 metres. Surface and back up about 1 metre, and perform a head first dive again and check a further 2 metres. Notice that by doing this you are overlapping. Even your hands should overlap when checking the bottom. The success of a team search is dependent on having a team leader who can give clear instructions and keep the team together. The team should perform the same pattern as for an individual, making sure they maintain a line. They should swim close enough so that their hands overlap. Recovery of a submerged person. When recovering a submerged person, speed is always of importance. On reaching the person, hold them under the arms and bring them to the surface. To support them in deep water, use a strong leg action and maintain head tilt with a pistol grip.
Rescue breathing in water. As a general principle, an unconscious person should be removed from the water as quickly as possible to commence CPR immediately. If you are unable to remove an unconscious person from the water, you will need to commence rescue breathing as early as possible. Allowing the person's body to drop vertically will assist in maintaining an open airway. Mouth to nose is the most effective method in water as it is easier to get a seal. With one hand on the edge and your legs astride the unconscious person, support the neck over your arm. Always look, listen and feel, even in the water.
Vice grip. To apply a vice grip, place one arm along the backbone and support the head and the other arm along the middle of the chest and support the chin. Squeeze and turn with your elbows. Do not lift the person out of the water.